Hello and welcome to Local Doctors on Call. I'm Wendy Mann-Resnick. Do you have cloudy vision? Have you had your eyeglasses changed recently but you still can't see well? Do you have increasing problems driving at night, or even worse, you can no longer drive at night at all? These are all symptoms of cataracts. But the good news is cataract surgery is one of the most frequently performed and most successful operations in the world. Today our guests are board-certified ophthalmologist, Dr. Cathy McCabe of the Eye Associates, and Dr. Susan Beck. Dr. McCabe was named the premier surgeon on 250 lists of the leading innovators of the premium IOL cataract surgery. Dr. Beck is a board-certified optometric physician, a favorite here in Sarasota, and a favorite on our show. And so we're delighted to see both of you ladies again. So
great to be here.
Well, I'm so glad. And here the holidays are coming, and so we need to find out what's going on with cataracts. So Dr. Beck, would you tell our audience what is a cataract and who gets them?
Sure. A cataract is a clouding of the lens that affects your vision, and the lens is normally clear in the back of your eye. It sits behind your iris and your pupil, and it works much like a camera lens. Its job is to focus light into the back of your eye, your retina, which acts like the film to the camera of your eye that sends an image to the brain. So in a normal lens, it's transparent, and therefore the light that comes in is clearly focused and makes a nice sharp image on your retina. And in a lens that has a cataract or cloudiness to it, that image presents a blurred image. That lens creates a blurred image onto the back of your eye, your retina. Therefore, your vision is blurred. Most cataracts are age-related, but age-related is sort of misleading because many people in their 40s and 50s have age-related changes to their eyes, and at that stage, though, usually around that middle age, it's usually small, the cataract, so it doesn't affect your vision so much. It's usually around 60 that it starts to steal your sight, the cataract.
That's lovely. Uh-huh.
Yeah, and like I said, most of them are age-related, but there are other types of cataracts you can get. There's ones that are secondary cataracts, which might be from prior surgeries that you have had, like glaucoma surgery or diabetes. There's traumatic cataracts, which could be from an old injury that could come out years later. We can discover, oh, were you ever injured in your eye? And you find out 30 years ago you were. There's something called a congenital cataract, which is something you're either born with or develops in early childhood. A lot of times that's small and they're on both eyes, but those are also a type you can get. And you can also get some from radiation.
Oh, that's interesting.
Yeah, and it affects one eye or both eyes, but it never spreads from one to the other, so that's important to know.
Well, I have another question for you, but before I do that, I just want to remind our viewers that if you would like to ask Dr. McCabe or Dr. Beck a question about your eyes, we'd love to hear from you. Our number is 361-4675. And we're talking about cataracts tonight, but if you have a question about your eyes that is not related to cataracts, you can still call in and they'll answer your question. And so, Dr. Beck, what is the most common complaint about cataracts?
Well, there's several. Sometimes people don't even know that what they're complaining about happens to be from a cataract. A lot of times people say that colors have faded and they're not aware. They think they're wearing black socks and their friends point out that they're wearing purple socks, so that's a sign. Frequent changes in your eyeglass or contact lens prescription. Sometimes you get double image or multiple images from having one cataract more advanced than the other. Also, you can get halos around street lights and headlights, and lamps, headlights, and sunlight create a lot of glare that bothers your eyes. So these are pretty much things that can affect from other sources as well, but frequently they are from cataracts as well.
It's so nice that there's such good news about cataracts and that it's such usually a successful surgery. And
yeah, really, it's not a bad thing to have cataracts anymore. And one of the things, just to add too, like you were saying, if you have one cataract, sometimes all you notice, because we're binocular beings, we have both eyes open, we don't notice if we've lost vision all the time in one eye. So, but what you will lose if you have very poor vision in one eye is depth perception.
Yep.
Oh, that's interesting.
Yeah,
and
so sometimes, if your spouse is driving with you and saying, why are you so close to that car all the time, or elbowing you a lot for that, Could be that you have poor vision in one eye and you just haven't checked your two eyes independently.
And it also could be that he's too close to the car in front of him.
Could be
Yeah.
that.
Or you're a backseat driver.
Yeah, exactly, which I'm sure I am. And
Yes, me
so
too.
this is age-related, but you had mentioned that there's other causes for this with genetics, and so young people can also get cataracts if they have a genetic predisposition to this. Is that how it works?
Sure, that can happen, or you might even be on a certain medication. Like frequently, athletes might take steroids, and they always think I'm accusing them if I say that, but not the steroids that you think of to really bulk up. But oftentimes, if you have an injury in a knee or a shoulder, you may have had cortisone injections for pain, and that's a steroid, and that steroid is actually frequently associated with an acceleration of a certain type of cataract too.
Oh, that's
So-
very interesting. And how many cataract surgeries have you performed, Dr. McCabe?
Well, I really have stopped counting them individually, but somewhere around 34,000 cataract surgeries or more, yeah.
That is amazing. Now, I know that you do the latest in cataract surgery, the bladeless laser cataract surgery
Yes.
with a lens X laser.
Yes.
So what is bladeless laser cataract surgery?
Well, we're really excited to be able to offer this to patients because this is a new technology that actually allows us to image the tissues of your eye and customize all of the critical steps of cataract surgery to you, to your eye, to what we need to do. And I think we have a video that we can kind of show how
great.
that works.
I would love to see that.
So this is a video of a patient who has their eye imaged. This is a patient's eye. You can see the pupil in the middle and the iris around that. And this allows us to make all of the incisions that we would typically make with a blade instead with the laser. And what's happening right now is the central opening in the membrane that surrounds the cataract is being cut with the laser in a very specific shape, a circle of a very, very specific size and right in the center. And those are critical features for us to have very predictable results in where the implant will sit. And it's also softening the nucleus right now. So the cataract itself is being cut by the lens or by the laser so that it's easier and less energy to take those pieces out. And we'll be able to look at that a little bit in more detail, but that's it. Right at this point, we're making some incisions to decrease the astigmatism a patient may have. We're making the incision that will actually allow me to enter into the eye, and all of that took place in the time that we were just looking at that video. So it's very
That
quick.
was in real time.
That was real time, and in fact, that's kind of a little bit of an older video in the fact that it is about 1/3 faster than that now, than even when we taped that video.
So like the next time I see you could be like 64,000 surgeries.
That'll be slow motion.
Exactly. We'll have to slow it down just so you can see it.
And if you have a question tonight, give us a call at 361-4675. And so how is bladeless laser cataract surgery different from the traditional surgery, and what are its advantages?
So, like the name implies, we typically would use a blade for traditional cataract surgery. And with the bladeless system, the laser does all of that in a way that is exquisitely precise and customized to you individually in a way that we can't do by hand with a blade. So I think, again, we have a video that will demonstrate that. So this is what the laser looks like. It's actually a platform, and then there's a beam that comes down. It's a cool beam. There's no heat. It's painless. And if you look at this right now, we're imaging the tissues of the eye, and it takes that yellow blurry image to make a nice clear sharp image. So traditionally you would use a blade to make the incisions that allow us to get into the eye, and instead those are made with this laser that's cool and painless. And traditionally we would use a blade to decrease the astigmatism, which is that curvature of the cornea that's steeper in one direction than another. With the laser, we can do that in a way that's absolutely shaped to the shape of your eye and a very, very specific and precise depth. The next thing that happens traditionally is that we use a sharp needle or another sharp instrument to peel away that central portion of the membrane around the cataract instead of having the laser do that in that precise way we saw on the video previously. Traditionally, we use ultrasound, like I've said, to break up the cataract and take it out. And that requires quite a bit of energy to make those initial cuts in the lens itself. But we instead use the laser to do that, and allows for just a quicker and more elegant and gentler way of removing the pieces of the cataract there. So once the cataract is removed with either system, the next step is to go ahead and put that implant in. And that's what that was showing. And once the clear implant is in, you can see better, and that cloudy yellow image has now become the sharp clear image. And
It's
that's
amazing.
that. So cataract surgery itself is really an amazing surgery in that it's quick, it's painless, and has really wonderful success rate. But using the laser allows us to increase that level of precision and that experience for the patient just that much better and that much more precise.
That's terrific. Well, we're going to take a break right now, and we'll be right back, so stay tuned. Cataracts and bladeless laser surgery are our topics tonight with Dr. Cathy McCabe of the Eye Associates and Dr. Susan Beck. If you'd like to watch this show again or share it with a friend or loved one, tune in Sunday morning at 10:30 for an encore presentation of Local Doctors on Call. That's Sunday morning at 10:30 right here on SNN Local News. So now we're back. I'm Wendy Mann-Resnick. This is Local Doctors on Call, and we're talking about cataracts with Dr. Cathy McCabe and Dr. Susan Beck. And so we're learning about bladeless laser surgery. And so I want to know, why did the Eye Associates choose the Alcon Lens X
LensX.
laser?
Yes.
What's it called?
It's
LASIK?
the LensX laser.
LensX laser. Oh, that's not easy to
we're
say.
getting rid of the cataract. So, it's a way of using that lens to explant a cataract. So LensX.
Why is this one better? Why is this one better? Why did you all choose this particular brand instead of
Well,
another?
currently there are 4 different platforms available, and we did a lot of research to see what we thought would be absolutely the best technology to offer to our patients. And there are a very limited number of lasers that are able to do the wide range of things that the LensX can do. And in fact, it is the only one that's approved to do all the indications for femtosecond laser. And it still is, even a few years later. So we've really been so excited to be able to offer all of those different, very precise procedures. It also is the most placed laser in the world, in fact, by quite a bit. There are many more LensX lasers and LensX laser users in the world today. And as a group, we can get together and share information and techniques and just continually refine the outcomes that we're able to achieve.
Interesting. Very interesting. It must be an amazing machine. So we have Carol Ann on the line. Carol Ann, you're live in the studio with Dr. McCabe and Dr. Beck. What is your question?
My question is that I'm new in Florida and I don't know how to find the right surgeon to do cataract surgery, and I know I need that. So far, I think the one I have is very good, but I've been having a problem with contacts and glasses, and I can't seem to. They can't seem to find sharpness for my vision. So my point, what I'm asking is, how do I know if they're going to be accurate with my testing to do cataract surgery?
Well, whenever you have a procedure done, there are some things that you should do to make sure that you're going to somebody you're comfortable with. So the first thing is, how do you feel about that relationship? Are you able to talk to your doctor? Does your doctor